What's up, guys? This is Dr. Dino Reyes, and today we're going to talk about GHK-Cu. So, this is one of the best peptides in our arsenal when we're talking about skin health and health, hair fall reduction, or like all of those things, okay? So, what is GHK-Cu? The most important part, I think, is the Cu. That's Cu, like it stands for copper, that on the elemental table, on the periodic table. So, the GHK-Cu is a very, very small copper binding tripeptide. So, just three peptides it's glycyl, L-histidyl, and lysine plus your copper, and it occurs naturally in human plasma, in your blood, in your saliva, in your urine, and it was identified by Dr. Lauren Picard in 1973. And what we found out about it is that it declines significantly with age. So from around 200 ng per ml in your youth to around just 80 ng per ml by age 60. That's why the skin and the hair, that's one of the first things that's obvious with regards to people aging. And why is GHK-Cu so important? Well, it is a chelator. So it chelates your copper 2 ions and which enable key biological functions such as connective tissue repair, antioxidant defense, and the modulation of your metalloproteinases and their inhibitors, which are big sciencey words, but really those are very important aspects in terms of skin health and hair health. So, like with our previous videos, we're gonna go nerdy. We're gonna talk about the biochemical reactions and the mechanisms of action of these peptides and how they are important in terms of what we want them to do. So, let's go ahead and start. The first effect of GHK-Cu is with regards to gene expression and cellular regulation. What does that mean? GHK-Cu interacts with the cell surface receptors and they directly bind to nuclear transcription factors. So they're in the nucleus of your DNA and they are in charge of transcribing or relaying genetic information. They basically turn on and off different genes. So they enter through the cell through endocytosis or through copper transporters like CTR1, copper transporter 1, which is why it's so important to have copper in regards to your diet and in this case specifically an additive for that peptide. Why is copper so important? So it is a cofactor for several enzymes such as lysyl oxidase, superoxide dismutase, and tyrosinase, which we'll be coming across multiple times during the lecture. But basically, they are crucial for connective tissue and antioxidant defense. Okay, and this interaction between the peptides and copper modulates up to 4,000 genes in your body, and it upregulates DNA repair enzymes, so it makes them work better. It also upregulates antioxidant genes such as superoxide dismutase 1 and catalase. It upregulates growth factors, things that promote growth and regeneration like VEGF or vascular endothelial growth factor, TGF beta, and it also upregulates your extracellular matrix proteins. Okay, so that's all of the good things that it makes work better. On the other hand, it also downregulates things. It downregulates pro-inflammatory cytokines, so things that cause inflammation such as tumor necrosis factor alpha or interleukin 6 and other proteases that break down collagen, which is super important for your skin. Why does this matter? Because in the skin, when these things are upregulated and these things are downregulated, it promotes a more youthful cellular phenotype or a more youthful cellular look or an appearance of your cells. It improves your cell's ability to repair UV and oxidative damage, and it also reduces chronic inflammation. Personally, I hate my skin. So my skin is so reactive all the time. And I've done all the creams and all of the regimens, and for the longest time, there was nothing that could keep it in check. But I've had significant amounts of improvement and results with these peptides. Okay. For the hair, on the other hand, it also promotes a healthier gene expression of a profile that supports your follicle stem cell survival. So basically, the stem cells that are in charge of keeping your hair follicles healthy and alive and young. It's also very, very useful in nutrient delivery and in angiogenesis or the creation of new blood vessels, particularly with VEGF. And it also reduces the inflammation that contributes to a lot of follicle miniaturization. One of the most notorious ones is caused by DHT or dihydrotestosterone, which is the main component responsible for male pattern baldness. So that's the first thing that GHKCU does. It has a lot to do with your gene expression and how your body is able to regulate your cells. Uh, on the other hand, it's all on a second point, it's also very, very important for collagen and elastin and your extracellular matrix remodeling. What is the biochemistry of this? So GHKCU binds copper and activates lysyl oxidase, which it cross-links collagen and elastin for a stronger dermal architecture. So that means all the framework or the scaffolding in your skin, that is your extracellular matrix. So um, copper is super, super important to be able to activate the lysyl oxidase, which is responsible for the cross-linking. So how they connect to each other. More cross-linking, you got better support. So a stronger skin architecture. It will also stimulate fibroblasts, which are very important to produce structural proteins, such as your collagens type 1 and your collagen type 3, which are the main collagen types of collagen in your skin. It will also stimulate your elastin, which is the one responsible for your skin's recoil or like the bounciness of it, and also glycosaminoglycans, such as example their hyaluronic acid, which provides hydration. And then a lot of you guys probably know how hyaluronic acid is used as a topical serum to keep your skin hydrated. So your body can actually make that on its own. It's produced by your fibroblasts, and using GHKC will promote the creation of more of those fibroblasts. What else? It will balance your matrix turnover, meaning how your body like makes a new set of your extracellular matrix. Like as the days go by, you need to renew that. It upregulates TIMP1, which is tissue inhibitor of metalloproteinases. It also regulates your MMP1 and 2. So those are your matrix metalloproteinases, so that a damaged extracellular matrix is cleared, but the healthy collagen is preserved. All right. And why does this matter for your skin? So, in your skin, it improves the firmness, the thickness, and the elasticity of your skin. It reverses the thinning and the sagging caused by aging, and wrinkles reduce as dermal density increases. Because, like, the stronger your scaffolding is, then less drooping, less wrinkles, right? For the hair, on the other hand, extracellular matrix remodeling is also important because it creates a much healthier follicular niche. So, like the bed or like the soil where you want to create your hair follicles, you get a healthy one. And then the basement membrane on your scalp and the dermal papillae become more robust, stronger, and then therefore they can support thicker, stronger hair shafts. Um, so overall, it gives about it's the strength and the structural integrity of your extracellular matrix, and GHKCU really is super important to that or super helpful. So the third one is more about wound healing and inflammation. The skin is really your primary barrier against your environment. So it is your vanguard, or it's your vanguard in terms of all the assaults that your body will experience throughout the day, so it will take a beating. And that doesn't mean like big gaping wounds, but you will get a lot of inflammation and like assaults or like injury to it. So, in terms of the biochemistry, GHK-Cu acts as a chemotactic factor. What does that mean? So, its job is to attract endothelial cells, macrophages, and fibroblasts to the wound site to promote healing. Chemotactic means it's an attractor of certain of these other cells and other components. So it recruits them, it calls them where they need to start working. It also enhances angiogenesis, as we previously mentioned, by increasing your vascular endothelial growth factor, and also your FGF, or your fibroblast growth factor expression. So not only does it call or recruit these components, it actually also initiates your body to produce more of them. Next, it also stimulates your antioxidant enzymes. So we hear people talk about antioxidants a lot, and a lot of times you don't really know what that means. But basically, oxidants are like these free radicals or these free molecules of oxygen in your system, which are very reactive. So when they attach to things, they basically things in your body, they can destroy them. It is a redox reaction, which is the same chemical reaction that occurs when you burn things. So in many ways, oxidants kind of like burn your body on a molecular level from the inside, and we don't want that to happen. So one of the most important antioxidants out there is your superoxide dismutase. It converts harmful superoxide radicals into just hydrogen peroxide, which your body will process. Catalase and glutathione peroxidase also clears these hydrogen peroxide, which is super important. Overall, the effect of this is that it reduces your pro-inflammatory cytokines, like your tumor necrosis factor alpha and your interleukin 6, thus limiting the chronic inflammation, and it all that is responsible for slowed healing. If your body is constantly inflamed, then healing doesn't kick in. So you want to keep that in control. And why does this matter again for the skin and the hair? For the skin, it accelerates your healing from injuries and micro traumas. That's why GHK-Cu is also super recommended after you have traumatic or ablative procedures like microneedling or like carbon lasers and stuff like that. It reduces the risk of fibrosis or stiffening and hyperpigmentation by controlling the inflammation. About for your hair, miniaturized or shrunken hair follicles are often in a low grade inflammatory state, meaning they're constantly in an inflamed state. Okay, GHK-Cu will be able to improve the local circulation because we've done the angiogenesis, or there are more blood vessels in that area, and it also reduces the perifollicular inflammation. So that's the inflammation around your follicles, and it will support the regrowth and will also prevent further hair loss for that. So those are pretty simple ways to explain why GHK-Cu is so important. In many ways, the beauty or the power of GHK-Cu is how simple it is. So like I said, it's just a three component peptide. But it's crucial for your skin and hair health because it will restore your youthful gene expression by resetting aged cells. GHK-Cu helps your skin and hair behave more like they did when you were younger. And like we mentioned earlier in this discussion, you have so much more of it when you're young, and then it decreases as you get old. So when you supplement with GHK-Cu, you kind of top those off, right? It also strengthens the scaffold of your extracellular matrix, and we talked about collagen and elastin and other extracellular matrix proteins that form the structural support both for your skin and your hair. It reduces the inflammation, which chronic inflammation accelerates skin aging and is a key driver in hair follicle miniaturization, or in many ways androgenic alopecia or male pattern baldness. It will also improve your vascularization. Better blood flow means better oxygen, better nutrient delivery, and also very essential for follicle survival and dermal or skin repair. And overall, GHKCU doesn't mean you don't have to use the other aesthetic treatments. Actually, it has a synergistic effect. So, if you want to get procedures like microneedling or PRP or laser procedures, you can actually control the injury created by those procedures with GHKCU, and it supercharges the healing response for much better outcomes. Bottom line, the biochemistry of GHK-Cu isn't really just about the collagen. It's about reactivating your body's innate regenerative capacities, and this dual action both on your genes and on your extracellular matrix remodeling is one of the most powerful tools we have in skin rejuvenation today and also in hair restoration today. You guys are probably saying that sounds too good to be true. What's the evidence for that? And it's actually very fortunate that there's a lot of studies about GHKCU. Okay, GHKCU can be given through like multiple mediums. We have them in creams, we have them in serums for your hair or your scalp, and we also have them in like these vials that can be used as subcutaneous injections or can be integrated into like other aesthetic services, such as the microneedling and all of those things. So let's talk about the clear evidence that we have on these on GHKCU. So there was a 12-week randomized study for about 71 women with skin damaged skin, and a GHKCU facial cream was used. And what they were able to find that after the 12-week program, there was increased skin density and thickness, and it improved the laxity and clarity of their skin and reduced the wrinkle depth and fine lines. So that was just a cream option, which makes it very easy for you to integrate into your daily routine. There was another 41 subject trial that used an eye cream over 12 weeks that showed greater improvement in the periorbital or the eye wrinkles and skin density than with a placebo or a vitamin K cream. There was another pilot study that focused on skin on the thighs. This was a 12-week study where GHKCU was applied to thigh skin, and it also was able to see an improvement in collagen production, about 70% of women, which also outperformed vitamin C, which just showed a 50% improvement, and retinoic acid, which just showed a 40% improvement. It also stimulated their keratocyte proliferation, which is like the most outer layer of skin that does most of the protecting. About, and I'm sure many will ask about like the safety and the regulatory rules behind using products like this. So this peptide has a long safety record, and at nanomolar doses, meaning in such small doses, it's really super safe. However, there might be cases where the overactivation of these MMP1s or matrix metalloproteinase may sometimes accelerate collagen fragmentation. So we call them copper uglies, actually. That's the term for them in the field. But these reports are largely anecdotal. It's just a hypothesis of sorts. And so far, long term human data remains limited, but in terms of the studies, it looks like it's very, very safe and it works significantly better than what we have on the market. For the hair, there have been animal studies. In mice, it was seen that it promoted hair growth more effectively than minoxidil by shortening the telogen or the resting phase of your hair and then prolonging the anagen or the growth phase of your hair. It also upregulated your vascular endothelial growth factor and your hair and your HGF, and overall it improved scalp angiogenesis. For clinical and aesthetic use, yeah, GHKCU has been used in the aesthetic practice, and there are a lot of preliminary human models to enlarge hair follicles out there and to improve follicle growth. So it makes it a very, very good candidate and adjunct for alopecia or hair loss therapies. Ultimately, when you want to summarize all of those things, what are the benefit areas of GHKCU and what are their key effects? For skin remodeling, you increase your collagen, elastin, dermal thickness, and it improves elasticity and reduces wrinkles and hyperpigmentation. As an anti-inflammatory, it lowers your TNF alpha and interleukin 6 and promotes antioxidant enzyme activities and balances your ECM remodeling. For wound healing, it accelerates reepithelialization and granulation tissue formation as well as angiogenesis. And for hair stimulation, it extends the anagen or the growth phase of your hair. It enhances your follicle size and it also improves vascularization and growth factor expression. So let's talk about how we can sorry. So let's talk about the different clinical applications and safety tips of GHKCU. So typical formulations, as we mentioned earlier, include serums or creams, often at about zero point zero 0.01 to 1% of GHKCU that is applied topically once or twice a day. But delivery enhancements are available out there, so you can get GHKCU in a vial, and you can use it as an adjunct for microneedling or dry cannula and other things for aesthetic procedures. How fast do they work? Hydration and mild smoothing in about 1 to 2 weeks, you can already see a noticeable difference in your wrinkles and your skin texture. In about 1 month to 3 months, then you'll be able to see more of that. Sorry, ayusin ko yan. Okay. So how fast does GHKC work? Okay. So in about 1 to 2 weeks, you'll already notice like hydration and a mild smoothing in your skin. In 1 month to 3 months, you'll notice there'll be more noticeable wrinkle and texture improvements. And then after 3 months and onwards, you'll have a more sustained remodeling, meaning you have overall better improvement in your skin. You want for the safety profile and the potential side effects. Of course, if you're putting something on your skin, you want to make sure that you're not allergic to it. So a patch test for before using more regular use is good, and you also want to avoid using other concurrent strong like topicals such as retinoids or like vitamin C during the initial phases, and want to try and test run which correct combination of products might be best for you. What are the contraindications? Those are the times when you can't use them. Of course, those with like active cancer, especially skin cancer, because when you use GHKCU, it'll make everything grow, including the cancer. So don't use that. Or any big skin disease or skin concern. We also want to avoid using it for women who are pregnant or breastfeeding because there are not a lot of studies that say that show anything can be used there. And also, there's not a lot of studies for young people, so we don't want to give it to anybody under 18. But what are the key takeaways for GHKCU? So GHKCU is a natural regenerative peptide. It's just that its levels decline with age. So why do you want to supplement with it? It's to bring those levels back up. It modulates your gene expression to reset aging-related pathways, push them towards repair and regeneration. Clinical trials have consistently shown skin tightening, improved density and clarity, elasticity, as well as wrinkle reduction. Animal and preliminary human trials support its role in hair follicle and stimulation growth. And with careful application, formulation, and the guide of a knowledgeable doctor, it offers like a broad spectrum anti-aging benefits across your skin and your hair with a very good safety profile. That's about it. In terms of the dosing, you can really just start with a 1 to 2% cream or solutions. And then if you want to do it subcutaneously, if you have like a vial of GHK-Cu at 10 mg and you can dissolve that in 2 ml of sterile water, you just want to get around 1 to 2 mg, which you inject subcutaneously around 3 times a week. Make it Monday, Wednesday, and Friday to make it super simple. Okay? So that's basically all I want to talk about with regards to GHK-Cu. Like I said, it's a super simple peptide structure and its effects are also relatively simple. If there's anything else you want to know, then feel free to contact us and just ask away. Bye.